Somatoform disorder is a mental health condition characterized by physical symptoms that have no clear medical explanation or cause. The symptoms may include pain, gastrointestinal problems, neurological problems, sexual dysfunction, and other physical complaints that cannot be attributed to a specific medical condition. Individuals with somatoform disorder may be preoccupied with their physical symptoms and may believe that they have a serious medical condition despite reassurances from medical professionals. This preoccupation with symptoms can cause significant distress and impairment in daily functioning. Somatoform disorder has been renamed in the DSM-5 to Somatic Symptom Disorder, which combines the previous somatoform disorders into one diagnosis. It is important to note that this disorder is not malingering of physical symptoms but genuine mental health condition and requires appropriate treatment. I have seen a somatoform disorder patient during my medical placement, and that patient was a middle-aged woman. She has done all sorts of tests like chest x-ray, CT scan, blood test, urine test, liver function test, kidney test, everything. But none of these test results revealed anything. Her only complaint was headache and generalized body ache. Let's consider today you are the SHO of medical OPD and you have got this patient, and let's give her a name. Her name is Mrs. Humaira. She has done a blood test and now she is here to know her test result, and as an SHO you should go to the patient and introduce yourself. Hello, I am Dr. X. I am the SHO of medical outpatient department today, and are you Mrs. Humaira? And she would confirm her name and age. Then you should confirm the agenda of today's meeting, which is the discussion of blood test result. Then ask the patient, how much do you know about your health condition? Do you have any expectations for results of the blood test done for you? Dear candidates, this type of patient usually expect to be diagnosed because they absolutely believe that they have a diagnosis. That's why the patient may have expectation that finally after doing so many tests, today her disease would be diagnosed. If she tells you about this type of expectation, then gently smile and tell her, Mrs. Humaira, I have a very good news for you today. Your blood test result is absolutely normal. What do you think about this? After listening to your good news, the patient may actually be very angry because she was expecting to be diagnosed. So she can rudely tell you, Doctor, do you think I am telling lies or I am malingering? Do you think I am really disease free? I am medically free? If I go back to my home with this normal blood test result, how would my family think? They would think that I was a liar for all these years. If the patient is angry, then apply some skills of angry patient management. Let her express her anger. Keep calm and listen to her, and when she would finish, then you can start talking. Dear candidates, you can tell her, I really appreciate your feelings and anger. I don't mean that you are malingering at all. I didn't tell you that you are a liar. I admit you are suffering and you have something wrong we have to manage. And you are absolutely right about it. We are here to offer you help. Then ask her permission. If you allow me, I can explain your health condition. And she would allow you to explain it because she is expecting some diagnosis to be made. You can tell her your symptoms are mostly due to physical stress and probably you are also overwhelmed with a lot of tasks and responsibilities. Sometimes some people under mental stress develops physical symptoms like headache, chest pain, generalized body ache. Some people also develop loose motion and fatigue. Our body somehow converts the mental pressure into physical symptoms, and we call it somatoform disorder. I think you have this condition. Dear candidates, a somatoform disorder patient may not accept this diagnosis because she is experiencing physical symptoms and you are telling her that it is not physical, it is mental. It is very hard to understand for a non-medical person. If she is still angry, then try to calm her down with gentle and diplomatic answers. When she is calmed down, you should take a detailed social history. Detailed social history is very important to pass this station because the cause of her extra mental stress and responsibilities may hide in her social history. So ask her, what do you do for living? Is there any stressful situation in your workplace or in your family life? How much your symptoms affect your job life and your family life? Whom do you live with? What your husband is doing for living? Does he support you at home? Does he stay away from the house for a long time? Do you have children? Do you have any ill family member? Are your children doing well? What about their school performance? What about your financial situation? Are you financially sound? Do you have any comorbid factors like any diabetes, hypertension, any asthma or any other medical conditions? Do you have any painful condition? What about your family, mom, dad, brothers and sisters? Are they doing well? Do you think you need any social or occupational support? Can we offer any help if you need any social or occupational support? Any troubles with your neighbors? Any troubles with anybody else? Do you smoke? Do you drink? Do you take any illicit drug? Are you sexually active? How many partners do you have? Do you think you are under stress or overwhelmed at all time? Dear candidates, I have asked her a lot of social questions, and it is the key to pass somatoform disorder case in station 4. Then give her some management plan. You can tell her that you would refer her to a multidisciplinary team which would include social worker, psychologist, and also caregiver if needed. Then you can ask for her concerns. The patient might be very unhappy after learning that she might need a psychologist. She can tell you, "Doctor, do you think I am crazy?" Then gently explain to her that psychologists are not for crazy or mad people only. They can relieve your mental pain in various ways, like they can give you mental support, counseling, etc. She may insist you to do further tests. She can tell you, "I have body ache for so many years. I think it is due to some disease. I want to do a CT scan of my body." Then tell her that, "I am so sorry to know about it. I can understand your feelings and I know how much it is difficult for you. But these symptoms are most likely due to the conversion of your mental stress into physical symptoms. Furthermore, unnecessary CT scan would put you in danger of radioactive damage." If she is still not convinced and tell you that I absolutely need a CT scan, then please refer her to the consultant. Tell her that I can arrange another meeting with my consultant regarding this issue. Dear candidates, consultants are generally great at managing these type of patients because they are senior doctors. People tend to believe them more even if they give the same information. Lastly, make a summary of today's discussion, check her understanding, and offer help. Offer her some brochure, website address, leaflet, and department's contact number. This can be a quite tricky case for a junior doctor. The keys to pass this station is to show her sympathy and empathy, acknowledge her suffering, and manage her temperament in a calm and gentle voice. Never ever confront a patient.